I sharded my pants last
Oh my God.
Does that mean that all of Imaging heard my screaming, crying, and out of controlness? No duh. Except for I couldn't breathe, so I just held my breath for 3 minutes. Leaving somebody with Ellen is like leaving them alone. Because Taylor has my favorite nurse. It's so good not to see you admitted here, but why are you here? MRIs are clearly abnormal. I'm looking at the now, he's looking at the big picture. Oh, that's uncomfortable, like let me try to fix it. Good morning, vlog. It's not that early in the morning for me to be looking like this, but are you ready? We're still wearing the same outfit as yesterday. I just put on a different jacket, except for the purple jacket's in my bag. Because this outfit is completely MRI friendly. They'll probably still make me change into one of those nudist gowns, but I'm trying not to. Don't want to. And then my hair is a hot mess, but what's new in our lives? And I have to ask Taylor if I can tell you guys something, but she probably won't care, so I'll tell you when we get there, or she can just tell you herself. The vlog. Taylor, would you like to explain?
I sharded my pants last
Oh my God.
I opened the Snapchat and I just started laughing, and they were like, what's your problem? And I was like, you sharded.
Let's sit here up to eat, okay?
Well, we're up here now, and then in a little bit we have to go down to G22.
Now look at my phone. I'm pretty sure that's what it said, G22.
And then the misery begins. The fam is eating breakfast because Taylor has doctors in there.
Yeah,
Or
steel cut oats in it right now.
the person that I have to turn this way because it's too bright behind me. And look, TV is in my pocket, and we have Imaging in like less than an hour. So yeah, about
Oh, that's
that.
Well, you have
What I feel like about the Imaging is, okay, so like the surgeon came in to see Taylor, but then we're all in there, and he goes like this on Zeus, good luck today. And then he said, and then he looked at me, don't you have Imaging in like an hour? And I was like, and then we see him tomorrow, and maybe Taylor will come home tomorrow too, and then we could just have like a carpool party home or a caravan home. But I don't want to go down to Imaging.
Yeah.
We are going to hopping in my wheelchair. Radiology, and apparently one of my nurses from when I was here is here, but we didn't see her yet, but hopefully we'll see her after radiology, unless oh wait, she's also the one that was here the day that I had the MRI and ended up screaming for 3 hours.
Transfer come in, they're talking to them real quick.
So
It'll be quick.
Really?
No.
They interrogate them too?
yeah. They didn't interrogate you because I'm an adult, so they couldn't interrogate you after interrogating me. Okay, onward to Imaging. We're in Imaging waiting, and I'm trying not to be awkward because, I mean, I'm me and it's awkward whenever I'm around. But here's my band.
I'm pretty sure you're not supposed to wear it as a ring. I think you're supposed to wear it
I know, but I don't want to wear it as a bracelet. But when we checked in, the lady at the Imaging desk said, oh yeah, I remember her. We've never done outpatient imaging here, so does that mean that all of Imaging heard my screaming 2 months ago? Oops, sorry. And then
because I've called them so much.
oh, and then Zeus saw one of my nurses, so hopefully we'll see her today. And we're pretty sure it's Faith or Sarah, one of the two. I can't really remember because they kind of looked the same to me. Brown hair, long, yeah, you know. And she said that she looked like she saw a ghost when she saw her, so she was probably like, oh no, they're back, and there's gonna be a lot of screaming. It has been like an hour or something, We're still in the waiting room, and I'm starting to stress. You know how I was stressing like 2 days ago, where it was just like crying and out of controlness? That's how I feel right now. But I'm keeping it cool, or as cool as I can be, because I'm not very calm. And I have PB here with me. PB's necklace got taken off so that maybe PB could go back there with me, but he has eyes, so I don't know if they're gonna let him. And then I think we're also in like the surgical waiting room, or the surgical parent waiting room, because there's like people that are also majorly stressing. Like the lady behind me, she was crying, and now she's on the phone and she's been praying, and like there's a lot of people that like look like they came out of like a little procedure, and then they get pushed out in a wheelchair and they go home, and we're still waiting here because I have CT first, and then I have MRI. And then I told you, right, that the lady at the check-in desk said, oh yeah, I remember her. So like, does that mean that she knows us from calling so many times about these scans? Because they were trying to give them a heads up that I'm likely to have a little bit of a emotional wreck during MRI, or is it because when I had my last ones done they heard me? Because I mean, a lot of people heard me. Pretty much the whole hospital, anybody who we passed by from the little hospital all the way back up to the 4th floor heard the screaming, because they gave me the Dilaudid when I was in the MRI, and it just wasn't enough for the pain. We're done. The MRIs were not as bad as I thought they were going to be, except for they did make me wear a nudist gown, and they gave me like hospital pants, which I don't know whose waist those hospital pants were made for. Somebody came in from...
I was looking at her, I was like...
From...
trying to look at her from all angles, it was like...
Family
Her
Research...
voice is nice.
Yeah.
Yeah.
Oh my gosh, she was beautiful. From
She's
Family
gorgeous.
Research Center. But continuing on my story from MRI. The Flexion was the worst for me, because I started having one of my like shaking, where it's just uncontrollable shaking, and they were like, they're kind of blurry, and I was like, no duh. And then, so then we had to redo that one, but we did the extension in the meantime while they were looking at the really blurry pictures. And the extension was fine, except for I couldn't breathe, so I just held my breath for 3 minutes, because I was not about to squeeze that stupid little squeeze ball, because they're gonna just roll me out and tell me, just keep breathing, and then roll me back in. I squeezed that thing before. Really all they do is roll you out, and they're like, well, you only got like 5 more minutes to go, so roll you right back in. And then had to get an IV for CT, which we had this CT guy named Leonard, and we thought that that was her favorite guy because he was the young Asian guy, the only young Asian CT guy that they have, and apparently that is not him. So that was awkward, but now he thinks that that he's somebody's favorite. And Florence came to visit me at before MRI, like Child Life. She's actually Child Life up here somewhere. So when we're walking around later, hopefully she'll come in. Because I told her to come by. I was like, she's right next door to my room that I was in. And she was like, okay. And then the other lady, Julie, was really nice. Yeah. And the MRIs and everything, I guess, were fine. I don't know. And I don't even know. I swear they were not doing a CT of my head. I don't know what they were CTing, but he wouldn't let me have bunny on top of my stomach, so I assumed somewhere of my abdomen there was a CT happening.
Maybe they're trying to do your whole spine?
Maybe they wanted to take a look at the bend, but they kind of straightened me out, so who knows what it looks like on there now. And then I was just out of there. Wait, actually, one more story. They had to weigh me, and I got onto the scale, and everybody in the whole area is watching this happen, and only Mark noticed that I was falling. I was just like, you know how I just lean backwards and I don't have like the sensation to like, you know, bend your knees and lean forward? So I just started like falling off the scale, like, whee! And then he grabbed my shoulders, and so he was kind of holding me onto the scale and was like, there. So yeah, and then we're gonna go on a walk, and we're gonna make one of them to vlog us.
Me too.
Because Taylor and I are a sight to be seen. I mean, they walk in here sometimes, and
They look at us like, which one's the patient?
typically you don't have the person on the bed, and then a second person with this and like creaky leg brace. And yeah, earlier they left us in here alone, me and Taylor. Yeah, because that's like when Nolan had his teeth taken out. Leaving somebody with Ellen is like leaving them alone. It is. It's not like I can help them. And then I almost fell, and if I fell, Taylor was gonna have to press the button to get somebody in here to help me get off the floor. It was gonna be one of those moments of, help, I've fallen and I can't get up. But it wasn't her. She would be like, well, she's on the floor and I'm still in bed, so I didn't break any rules, but she's broken on the floor. Hello, vlog. We're outside, and they're walking with Taylor the way people used to walk with me, but guess what? I'm a free person.
Hello.
And we're on the world's hottest patio that isn't hot right now, and it's really loud out here. But there's the old hospital. I can't remember what floor that Taylor and I both stayed on at that hospital either, probably the 3rd. And we're on the 4th floor here, so I don't know. And she's in the yeah. Basically, when we go to scans, you go through all the hallways, all the way around till you get there. And then you're like in like the basement of that hospital.
Ellen knows exactly where everything is in the hospital, and I have no idea where I am. I think that was the old hospital.
Yeah. And then
Why was there last?
we are gonna go back to the hotel for a little while soon, because probably take a nap, and then we'll come back again this evening, and hopefully Danielle or Megan will be here so that Taylor can have them as a nurse. And they're really funny, especially if they're both together. First time ever I was too tall for something. I was too tall to ride in the baby cart. And we just saw a helicopter take off, and that one goes, that was supposed to be you! I did not want to ride in a stupid helicopter. Hi vlog, it's a lot of hours later. Whoa. And we have all taken naps because we were exhausted. And, well, we're still exhausted, but we're going back to the hotel because Taylor has my favorite nurse. So, and then, this is totally beside the point, but we have a balcony here. Not going out on it. And then we have like the world's biggest shower. No, actually, the world's second biggest shower, because when we stayed in, I think, San Mateo, we had a bigger shower, but it was like a weird shower too, because there was 2 shower heads in this other place, and so like you could take a shower and then like you could have a friend take a shower on the other side, but like that's weird, so why would you do that? And me talking with my mouth full of food. first off, Danielle is Taylor's nurse. I think I said that when we were at the hotel when I was jumping and I was like, ah! And then there's Taylor. And we're listening to our song again.
I rolled down.
I rolled down to, that's not the words, but it's I walked down, but we roll because I'm in a wheelchair.
And I'm rolling on my tummy.
Yeah. And then she brought in a twisty chair, and Megan's also here, and oh my gosh, she walked in the door and like Zeus didn't even recognize her. Well, TBH, I didn't either. But then she goes, oh my gosh, guys. And she was like, it's so good not to see you admitted here, but why are you here? But then we're here for this one. And tomorrow we get the results of my scanning today. And I need to ask him, my #1 question is, how can we make it so I can sleep peacefully without my head falling off? You guys, I'm loving this chair. Danielle knows me, and as soon as I sat down on it, she lowered it. It used to be a tall chair, like tall, so like that would be a normal height table. But you know, hospital tables are really tall, so yeah. Good morning, vlog. Look, we're on the balcony, and yeah, I don't know what to say. It's really pretty out here, and the sky is blue again, because yesterday it was all gray and gross and raining on us like the whole day. But I don't know what's going on today. I thought my hips were out of place, and that's why my legs felt so wonky today. But they are in place, and I'm still walking like I was on a horse or a boat for many hours. So, I need to lock. I got it. And then later we are soon to leave to see the neurosurgeon, and you know, we're gonna leave like probably now because it is 9:15, and then we will see him, and then we will probably go back and see Taylor for a bit or something, and then we will go to the pain doctor and then home. A long day, but it's all traveling homeward ways. Yay. Look at my mermaid pants. Woo! Mermaid pants. Yay! We are in the office, and yet I've shrunk another inch, or a total inch. I don't know. But anyways, we're in the office, and out there, isn't it beautiful? Because it's not raining. And then there's the weird fish behind Zeus's head, and the, you know, doctor posters, and the things on the wall. Did you know that not, well, I could show you later, but when they sit like I do, their knees don't cross over each other, and they can't do the little arm twisty thing. What? Thought everybody could do that. We are done with the appointment, and now we're back at the hospital again to see Taylor, and we're getting another neck brace, a different kind, for nighttime, and we're gonna do more physical therapy because that's gonna be real helpful. And that's pretty much it, right?
Yeah.
And then next time we come up here, we're gonna do another MRI because those are fun. And yeah, pretty much that's it. We're going back up there, so bye. We are now, well, we've left the hospital, and we are now at my next appointment, which is in like 15 minutes or something. Or we're supposed to check in 15 or something like that. But, yeah. I'll explain all of this probably tomorrow or when we get home or something. when I have time to put words to it. And then also this kind of could be resolved or a little bit helped by this appointment today, or could be exacerbated by it. So I'll see you later. Don't know if it'll be in there or on our way home or just once we get home. Good morning vlog. It is, I don't know, the day after all those appointments, and I said I was going to explain about my face, why I was like a mess when I'm dealing with a lot of my like head falling off symptoms right now. So hopefully I make sense, but I'm going to close out this vlog and then start up my new one. So I don't really know even still what to say about like that. The emotions were just like, I don't know, I was angry and frustrated, but like it's because so my MRIs are clearly abnormal. Like, I don't know what the angle is called, but there's the two bones, the C1 and then a bone that's inside of your head that they measure the angle of, and mine is completely straight when I do flexion, and then it's not too bad when I do when I do flexion. It's not too bad. Extension is really bad, but flexion causes a lot of symptoms. So the images were so blurry that it was kind of hard for like us to know what he was talking about, but he could tell what was going on in the blur of it all. And so our plan moving forward right now is I'm getting a new collar today, a new brace that's supposed to be worn at night. It's called the Minerva brace, so look forward to the next vlog to see that situation. It's quite intense. There is a band that goes around your forehead. It's like a chest harness, but hopefully that will help me keep my head on at night. That sounds so weird to say, keep my head on. And then I have a standing MRI, so when we go back for pain clinic, every time we go back we do another MRI just to see what is going on and see the progression of whatever is going on. But the reason why I was like mad and frustrated was because I don't think he was hearing me as I was trying to tell him, like, my quality of life like this is pretty dang low because sitting up is hurting. I can't lay down because my head feels like it's falling off, and like that's my best position for all my other problems, is laying just flat. So oh my gosh, thoughts are leaving my head. Yeah, so my quality of life is pretty low like this, but he doesn't want to just jump into the fusion because, one, that is permanent, and two, my age. I'm 19, so I have a lot of years ahead of me, but I'm looking at the now, he's looking at the big picture. We also, along with the brace, are supposed to be doing more physical therapy. I've been doing physical therapy for 8 years, or almost 8 years. I started just after my 12th birthday, so in a few months it will be 8 years. And we were seeing improvements for 6 of those years, and then the past 2 years, really all we've been doing is documenting huge regression of my body. So we still don't know if that is 100% connected to my neck or 100% connected to just my body deterioration, or if there's something else happening, which we're kind of thinking there might be another thing happening. Like, we know there's some sort of autoimmune process happening, but then even something more than that, because I have like severe tremors on my right side, which are increased somewhat with my neck movement and other things, but like it's real bad. We don't know what's going on with that. And so like when I look, or when we did the Flexion one, which is where they pull my chin down, I was the reason why they're so blurry is because my whole body started shaking from, I don't know, it's like my brain was trying to protect my body from something. We don't know what that something was because they were so blurry. But it kind of sounds like he wants us to do neck physical therapy, like isometrically doing that, which brings all out terror for me, because the last time we moved my neck around at all, so we just took off the collar, and just to see if I could sit up and hold up my head for a while, I ended up having trouble breathing, and the recovery time from that is like 2 to 3 weeks of just feeling like death. So I don't know, and I wanted to take a break from physical therapy, and you guys know that because I've been feeling like really discouraged by it, but apparently that's not going to happen anytime soon because I'm supposed to be doing more physical therapy. But they also alluded to the fact that no matter how much we strengthen my neck, until he either fuses it or puts me in a halo brace, which is the one where they like screw things into your skull and then like you have rods attached to a vest, like a harness vest type thing that you wear, my head is going to feel this way. And so to some degree, I just like, I get it that since I am 19 and there's so many years ahead, he doesn't want to fuse because that just puts stress on the rest of my back, and eventually those places may deteriorate enough that it needs surgical intervention there too. And we really don't know how much needs to be fused. I think he knows how much needs to be fused and isn't saying it because it's probably a much more major surgery than, like, we understand that any type of neurosurgery is a big surgery, but we don't, like, I think he knows how much he suspects needs to be fused in my body and doesn't want to, like, tell us, like, you guys don't understand how bad this is because of the t-shirt of pain and things. And like, I kind of know where nerves come from and go to from anatomy and just internet, and then just like doing a lot of research on things for my own body. And it kind of sounds like I have problems from like skull all the way to T2 to T3-ish. So that's a big section of my spine that's really unstable. So that's why I think he wants it, is just to really strengthen my back and try to strengthen the rest of my body. But and then he was talking about like wanting me to walk more and do more cardio and that kind of thing. But I also don't think they understood that I don't walk, not because of my head and not because of my neck. I don't walk much because my legs hurt because they slide out of place, and I'm actually just having more and more issues with my legs as we go on, because my hips now, like, they don't even hurt when they come out of place, but I can feel that they're out and it's uncomfortable. Like, it's just like, I don't know how to describe, like, in a normal fashion what that would be like, other than saying like when you pull your hair up and there's like one section that's like majorly pulled back and the rest is not. It's not where it's not painful. You just like, oh, that's uncomfortable, like, let me try to fix it. Yeah, that's how my hips feel when they slide out. But now I'm having issues with my tibia likes to dislocate on my one side, and then my left side is just a whole big mess of my kneecap doesn't really like to stay in place. But we try not to brace me because how my body compensates for the braces, and then on top of that, the other issue that's happening. So that's where we are neurosurgery wise. I kind of just wish we would just get on with it, because it's not a question of if the fusion is going to happen, it's when. And to me, I feel like either the halo brace or the fusion are going to be our best bet at improving my quality of life, like now. Don't know how it's going to be in the future, but how far into the future are we really even looking? Because like my body is trying to quit on us. And so yeah. And then the pain appointment went really well too. She scheduled me for a double appointment, so we had twice as much time as we normally would. And she really sees that my quality of life is suffering right now, because gosh, I'm trying not to like just break down and cry again. But we let her know about the psychologists and all, because she wants me to see a pain psychologist at their clinic there, which I agreed to do, because she said if I decide that that's not something I'm into, or that it's like too much for me, then I can have the one appointment and be done, and then only go back as needed for treatments or whatever. So pain wise, I'm still on the LDN trial, because it hasn't been, I think I've only been on it for 4 weeks, but she likes to give it at least 6 to 8 weeks to see, really give it a go and let it have time inside my body. And I told her I haven't seen anything like overwhelmingly bad, so I'm not opposed to staying on it for another month or so. But it might have caused a pain increase, but we might also just be dealing with like my body's progression of pain and everything. So we're really in like limbo there, like is it really helping or is it really not? And then on top of that, we're starting another Cymbalta trial, which that could have multiple good effects for me. Like it could help with the pain, but then also, since it's an antidepressant, maybe help with my like this that goes on. So that medication we are starting at a kind of a low dose, and then we're going up every week for a few weeks, and then that, I think we're giving that like again a few months to just go ahead and see how that works. And then my dad, I think, is scheduling a follow-up appointment today with, not like the follow-up appointment would be today, but like he's scheduling one today because he has a phone call with her today to discuss what we were talking about at the end of my appointment yesterday. And so she has some ideas of things to try to help with the just overall pain, because I'm in pain from head to toe. Like, we're at pain clinic and they asked, are you in pain? And I'm like, yes. And then this is like the nursing assistant or whatever. Oh my gosh, my nose is like cold, so cold that it feels like it's like on fire. But that's, I don't know why, because I'm inside and it's not even that cold outside. But anyways, so the nursing assistant asked, like, are you in pain? It's like, yes. And then she goes, where? And I go, my legs hurt, like ankles, knees, hips, my back hurts, upper back hurts, my neck, my head, arms. She goes, so pretty much everywhere. And I was like, yeah. And so she has an idea for something in the future. And then I had to sign in like the whole narcotics contract and everything, but we don't even know if I'm going to start narcotics or what, because of some medications that I'm on currently. increase your risk for respiratory failure in combination with a narcotic by like 4 times as high. And so that's what my dad's phone call with her is about today. He's going to talk to her about, if we start the narcotic, we will remove my other medication for sure, because we don't even know if that's helping or anything. It's just I've been in so much pain and everything that we've just been throwing everything that we can at my body to try to give some sort of relief. Like, I'm on some narcotic-ish, and it's left over from some other things, but it's just enough so that I'm not crying constantly, and I'm able to like sit up and if you ask a question, even acknowledge the fact that somebody's talked to me. Because before, as you guys know, I was just crying all the time. But then when I was spoken to by people, like, there was a 1% chance you would get a reaction from me, or even like an answer. So he's talking to her about my medications and everything today, and then when we go up there again, I don't know, it'll probably be another like 6 weeks to 3 months is about how far apart we set my appointments with her. And I really like her because she sees like the now, whereas most other doctors look into the future and they're like, well, if you're a few years older, it's like the surgeries and everything, if I was like 10 years older, we would be having a completely different conversation than it right now, because they're looking at that I'm not even 20 and we could be doing a surgery or something is permanent. But like, my quality of life isn't improving by any of the things that we're doing now, so I don't know what we're going to do, what is actually going to end up happening. We're going to email them today and see what can be done, and then get fitted for the new brace. I have an appointment to get fitted for the new brace at 12, and then when my mom comes back home tonight, we will email the neurosurgeon and his nurse and just kind of to touch base about like where our thoughts after yesterday's appointment, and see what else can be done, or why we're not like doing something more aggressive, because we know the physical therapy isn't going to help. Going to see a psychologist isn't, like, I agreed to see the one, but really going in and seeing one regularly is not really in the cards for us right now, because of I still need to like process and heal from the last 3 people, which we didn't tell him the full story on that. We did tell the pain doctor about that, and she's like, how do you have, she's like, you have something in you that's making you fight. Oh my gosh, here comes the tears. And she's like, because you're getting so many messages of like self-harm and like people telling me that my life isn't worth living because of some other situations that we kind of told her about. But anyways, now that I'm crying again, I'll see you guys in the next one, which for me is in like 20 minutes, because I'm going to export all the footage. I think it's time for me to do my morning meds, and then also more export footage, morning meds, and I need to try to handle some of my head feeling like it's off symptoms, like my vision. I need to figure out what needs to be done for my head for my vision today, and try to deal with some of my pain. And I'll see you guys in like 20-30 minutes, but for you it'll be in a few days, so bye. Thanks for watching, and oh, Bunny isn't here to say bye with me, but bye.